Hey guys, good afternoon. Good afternoon. Happy Wednesday, July 31st. Always happy to report a lot of people passing step one, including three of our students. We have one doctor, Dr. Anthony, he passed this morning. I have two other doctors that I work with one-on-one. They also passed. And then we have a couple of high scores on step two. So it's exciting stuff, really is. The reason why I share is because you guys need to know it's your turn too, right? You're going to get there eventually. Exactly. So today we do an MSK skin. MSA skin is, I would say, challenging because we have many different conditions in musculoskeletal. And whether it's osteoarthritis, osteopetrosis, rheumatoid arthritis, think of anything and everything that you can leverage for the exam. At the same time, we're thinking about skin, right? Derm, cancers, that's important. Also, bullous pemphigoid, pemphigus vulgaris, certain blistering conditions, right? They're going to ask you questions to see if you're able to differentiate one from the other. So that's why we do our very best to make sure we hit it hard so we have nothing to worry about. Now, because we did it last month, the month before, because you studied at some point doesn't mean you even know it. I think you do. You think you do. But the step one exam it's torturous and infamous for this. You study, you forget. You study, you forget. Because you memory issues is because there's so much information to study. That's the problem, right? You're in med school, semester after semester, you're focusing on focused topics. Here, it's everything. So if you're using your first aid, it is important to know if they give you bullous pemphigoid, which one is it? Is it anti-hemidesmosomes or anti-desmoglein? Anti-desmosomes, which one is it? You need to know, right? We did talk about hypersensitivity examples, 1 versus 2 versus 3 versus 4. So you know those are both type 2. This is where we say we have our points. Now, if you want to study and review everything, you can, by all means. For example, the epithelial cell junctions, right? We have the gap junctions, desmosomes, tight junctions. Those always gave me headaches. But those are good points. Just like when I tell you guys, we have certain conditions, certain areas in first aid and medicine that have certain steps. For example, collagen formation. Do we need to know every step? Possibly. Do we need to know where the steps are located? Definitely. Do we need to know which steps are affiliated with certain clinical correlations? Yes. Just like, for example, if I tell you about bullous pemphigoid versus pemphigus vulgaris, do we know which one of the junctions are involved? If you can't tell me that, I know it's not easy. These are details, but don't try to shoot for anatomy and other rheological things. You can if you want, if they're your strengths. But what I want to do is make sure you guys know the differences between one versus the other, especially when it comes to like cancers, right? We've done bone cancers before. We know certain bone cancers are located in certain areas. So this is exactly what I mean about getting points. Now, today we're going to do I have about 30 questions in this set. It's end of the month, right? It's end of July, which means starting next week, we're going back to the first week of August, which is obviously, in the morning on Mondays, Wednesday, microbiology, Friday, biochemistry, but the afternoon, we start with cardio again, right? So it's been a full month of intense review. Now I'm going to bring it all together in a review for you guys. MSK skin, I want to see what you know. You should want to see what you know, which is actually pretty cool, right? What do you remember? What don't you remember? So if you have any questions specifically when it comes down to these kind of systems, you should make a list. And then when you're going through first aid, you should say, well, what areas am I comfortable with? And what areas am I not? And if you attend these sessions each and every day, which you usually do, then you can allow me to pinpoint what you should be highlighting and what you should be aware of. This is why I recommend doctors who have AMBOSS to access a training hub and access all these questions that I post each and every day. This is for you, not for me. I've done these questions, right? So if you can eventually keep up with these questions or get to these questions when it's your time, to actually do, for example, MSK skin, it's a good indication you are on the right track, right? Yes. So I have 30 questions here. I've flagged quite a few. Some of them will be related to MSK, some will be related to skin, some will have a little influence of microbiology. Again, micro is everywhere. We can't get rid of micro. Not that we want to, because I am a person of points. And then later in step 2, you got to score 260 plus to be in competition with any possible specialty. So raise your hands up high. I want to see you guys answer questions. Again, raise your hands. Let's do a couple. Let's round robin. In my perfect world, everybody would do 2 or 3. But I know it's not easy for everyone to jump on physically. So at least you guys are here attending. Let's do a couple. Singh is on board. Then we have Dr. MD. We'll do a couple back to back. For those of us that are participating, if you like, answer the question, send me direct messaging, and I can respond to you that way to give a fair chance to those who are actively doing the question, because sometimes we obviously put the answers in, and I want to make sure, especially at this stage, for some of you, you actually are connecting the dots on your own, right? Awesome, cool. So let's get on to Singh on the West Coast. How was your day today? What did you do study related wise?
Going well so far. I did a few like focused articles that I missed like question wise to see kind of gauge where I'm at. So that was pretty good.
Good.
Um
It's good. Are you gauging? Are you keeping track of your incorrects? You keeping track of what's going on with
yeah.
what you have to focus on?
Yeah.
Good. Tell me, like I've told you before, guys, before we start, if your test is less than 60 days or 30 days, at this stage, you got to do multiple blocks a day. But if you still want to know where you're at, set up 40 question blocks of focus, check the incorrects. The rest of the day, focus on the incorrect topics, and then mix, mix, mix. You have to keep going. So let's read the scenario. Let's highlight what we can. And those of us are answering the question, guys, like I said, DM me directly so we can give Dr. Singh a chance to answer on her own. All right, Doc, take it away.
Okay.
Take a deep breath. Take a deep breath. All right.
Laboratory studies show leukocyte count of 2,000, 20% segmented neutrophils. A photograph of one of the skin lesions is shown. Which of the following virulence factors is most likely involved in the pathogenesis of this patient's skin findings?
Yeah.
Okay. So we have a 62-year-old woman with metastatic breast cancer comes into the physician because of a 2-day history of fever, chills, and new gluteal lesions. The lesions began as painless red macules and evolved into painful ulcers overnight. She
Okay.
received her 4th course of palliative chemotherapy 2 weeks ago. Temperature is 100.1.
So looking at the photo, not sure if it helps you, kind of doesn't help me. It might, not sure, but there's no library of photos we have to memorize. So if you're lucky, you see this, it speaks to you. Maybe it doesn't, right? Look at the question stem itself. Do you have an idea of what this could be? Honest, yes or no?
No.
No. Okay, I'm happy you told me because this will happen to all of you at some point on your exam. Why? Because it's inevitable. This is what they do. This is why I do what I do. Question, Dr. Singh. Looking
Mhm.
at the answer choices, are you confident or can you tell me what each letter is, which each one of these virulence factors are for?
50-50.
You could just knock them out one by one.
Okay, so the endotoxin I know is related to Pseudomonas.
Endotoxin is Pseudomonas. Okay,
Okay.
this is Pseudomonas. Now, we know Pseudomonas has 4 virulence factors, right?
Yeah.
Okay. There's PEEP. This is one of the E's. Endotoxin. Do you remember what endotoxin causes?
That one I think is the fever and shock, like the
Yes.
vasodilation.
Yes. fever and septic shock. Okay, so that's endotoxin. Just tell me the other ones one by one.
I think D is also Pseudomonas related, with the
Yeah.
EF2.
Okay, D is exotoxin. That's inactivation of elongation factor 2. Yes, so we have two virulence factors right here. Okay. Remember the alpha toxin by any chance?
Alpha toxin, I think that's Clostridium.
Clostridium. Very nice. Very nice. And then what is this one?
That one is Staph aureus.
Yeah. Good. This one,
I think E. coli.
E. coli, traveler's diarrhea. Very nice. And the first one, if we can,
Is that Bacillus?
this is Bacillus anthracis, anthrax. Yes, it
Okay.
is. Okay. So now we have to figure out the person that brought in front of us, right, is an older female. And this is how you approach some questions that clearly, let's put it this way. If you read a question and you're able to connect to get an answer, you move on. This training we have each day is for when A, you're not sure what the answer is, or B, we have to work more on test taking skills. So in this case, you're like, oh my, what's going on? But you already know all the toxins. Okay. So what do you see in the question some that's very, very important to point out?
The fever, chills, the lesions, especially since it went from painless to painful.
Doctor, fourth course of chemotherapy, 4 times. Fourth course of palliative chemotherapy in 2 weeks. 2 weeks ago. Okay. Do you think that's gonna suppress the immune system?
Definitely.
I think so, of course. Okay. And also that's gonna increase the risk of any kind of infection, correct?
Mm-hmm.
Okay. So now, question: what is this here? Is this neutral? Well, you have neutrophils, right? 2,000 leukocyte with 20% segmented neutrophils, 2,000 leukocyte count. Okay,
That's
so I'm
really
thinking,
low.
go ahead.
That's really low.
Yes. So I'm thinking immunosuppression.
Mm-hmm.
I'm thinking neutropenia. Tropenia. Okay, okay. So now this is where these questions get tricky because, guys, if this photo speaks to you, I can tell you it's not Bacillus anthrax. And you might think it is because it looks similar to this, but this is not. This is one of those A's that you stay away from. Okay. I want to help you with this. Now look at the other ones. We said this was traveler's diarrhea, E. coli. This was staph. This was Pseudomonas, and Clostridium perfringens, correct?
Yeah.
What is this overall, you think, in skin? What's going on here? Any idea, guys? Painless red
It's like
macule.
necrosis.
What is it?
It looks like necrosis.
Necrosis, doctor says. Check this out. This is where I help you. We're helping each other. This is features fever, rapidly evolving gluteal lesions, circular ulcer with surrounding erythema, and central black eschar. These are features of Estaima gangrenosum, which is Pseudomonas aeruginosa. Okay, Pseudomonas aeruginosus. But you see, there was central black eschar, right? Now, let me ask you this: if you thought it was necrosis, what would you think the answer would be? I told you it's not anthrax.
Well, I said necrosis, but I was thinking like the gangrene. I kind of said necrosis.
I mean, listen, I'm here as a team. So I need you to survive. I need you to start. You obviously know the bug. It's ended up saying Pseudomonas, right?
Yeah.
If you go to Pseudomonas, obviously in first aid, are we familiar with the mnemonics for Pseudomonas? We're familiar with that, guys, or no? You remember the Pseudomonas?
Not the full thing entirely.
Not the full thing, doctor says. The doctor says, you know what, man? I don't know the full. You should know the full. Because when I tell you the full thing is important, right? I tell you the full thing is important. Don't expect just to be tested on what you think you know. What we have, obviously, is pneumonia, sepsis.